Pastries and cakes may appear as harmless indulgences, often tied to celebrations, comfort, or social occasions. But for individuals with diabetes, they represent a profound and multifaceted threat. These foods are not just high in sugar, they are a destructive combination of refined flour, added sugars, unhealthy fats, and in many cases, artificial additives. Each of these components alone would pose difficulties for blood sugar control, but together they create a metabolic storm. The refined flour ensures that the carbohydrates are broken down quickly into glucose, while the sugar provides an immediate surge, resulting in a dual impact that pushes blood sugar levels dangerously high within a short period. The fats, often saturated or trans fats, then linger in the bloodstream, worsening cardiovascular health and compounding the risks that diabetes already brings. The damage from pastries and cakes extends far beyond temporary glucose spikes. Frequent consumption places the body into a constant state of instability, where blood sugar swings up and down dramatically. This volatility is not only exhausting to manage, but also highly destructive at a cellular level. Repeated spikes generate oxidative stress, inflame blood vessels, and accelerate the very complications that diabetics are already at risk for: eye disease, nerve damage, kidney failure, and cardiovascular events. The body is essentially placed under continuous assault, leaving little time for recovery between indulgences. Even occasional consumption can carry risks, as the effects of glucose spikes and unhealthy fats accumulate silently and progressively over the years. Another major concern is how these foods contribute to obesity, one of the strongest aggravators of diabetes. Pastries and cakes are calorie-dense, with little to no fiber, and provide none of the satiety that would help limit overeating. Instead, they encourage excess consumption because they deliver a quick burst of pleasure followed by a rapid crash, leaving individuals craving more. This cycle of overconsumption drives weight gain, particularly abdominal fat, which is strongly linked to worsening insulin resistance. Over time, the combined effects of excess weight and poor dietary quality further cripple the body's ability to regulate blood sugar, deepening dependence on medications and insulin therapy. The fat content of these foods poses an additional layer of threat. Many pastries are made with hydrogenated oils or shortenings that are high in trans fats, which are directly linked to heart disease. Diabetes already increases the likelihood of cardiovascular problems, and by consuming pastries, the risk is multiplied. The combination of sugar-induced blood vessel damage and fat-induced cholesterol imbalances creates the perfect conditions for heart attack and stroke. For someone with diabetes, this makes pastries and cakes not just unhealthy, but life-threatening foods that push them toward complications they may not recover from. Psychologically, pastries and cakes are also problematic. Their sweet taste and soft texture trigger strong pleasure responses in the brain, creating an addictive loop that can undermine self-control. For diabetics, this craving can be particularly destructive, as even one indulgence can undo days of careful management. The deceptive nature of these foods, small in size yet packed with sugar and fat, makes them easy to underestimate. A slice of cake or a croissant may not look dangerous, but metabolically, it acts like a concentrated bomb of glucose and unhealthy fat detonating inside the body. It is important to reject the idea that moderation makes pastries safe for diabetics. While small amounts may seem harmless, the reality is that the diabetic body cannot process these foods in the same way as a healthy individual. Even minimal consumption can cause destabilizing spikes, and repeated small indulgences add up to significant harm over time. The cost is not immediately visible but accumulates in the form of organ damage, reduced quality of life, and increased risk of sudden, severe events such as heart attacks or strokes. Pastries and cakes should not be seen as occasional harmless pleasures for diabetics, but rather as dangerous substances that steadily erode health. They combine the worst dietary elements into one product: refined flour, concentrated sugar, and unhealthy fats. The long-term result of consuming them is not just poor glycemic control, but a heightened trajectory toward complications that can shorten life and increase suffering. For someone managing diabetes, saying no to pastries is not about unnecessary restriction. It is about survival, about preventing years of avoidable pain, and about protecting the fragile balance their body is struggling to maintain.